taking prescriptions. All right, so but there are certain medications, antihypertensives, that are actually recommended for African Americans, and then they help in ensuring over time. Studies have shown that they help in giving good control. Okay, so but individuals may have side effects, and some of these side effects, I've mentioned them. And the causes of these side effects may not even just be because of those medications themselves inherent, but because they are taking these medications with some other medications. Now, there are some pain relieving medications that people take commonly, and when they take with their blood pressure medications, that reduces the effect of medication. So it may magnify side effects rather than the normal effect that this antihypertensive is supposed to give. So I was talking about some individuals that complain about burning sensation, the side effect. Even though we say you can take most of your antihypertensives, people can take without food. Sometimes we see people come to the hospital saying, I've not taken my medications because I have not eaten. Sometimes I'm alarmed. I say, no. Who told you that you can't take your medications because you've not eaten? So we try to give that proper counseling information so people can make proper changes. So individuals can take their antihypertensives without food. Okay. But there are certain individuals who probably have peptic ulcer disease, for example,
and so they need to eat before using their medication.
And then if there is any complaint at all, that's why individuals should be able to engage with their doctor, to be able to make those complaints known, the side effects that you are having. So the doctor can actually evaluate properly and be sure that is it actually side effect or is another thing that's showing up actually that needs to be checked.
Dealt with. Okay, yes. we need to go, but I need you to answer that question. Is hypertension
curable?
One more question. Is it curable?
Yes, thank you for that question. I say yes for that question because when people hear hypertension, you have hypertension. In fact, it gets some people into anxiety modes, depression. You know, there's a psychological effect to that diagnosis. But it's not the end of life. When that diagnosis is made, there are people that live into their old age. They don't even die from hypertension because it's well controlled. So I want to say that it is not curable as at today.
It can be managed.
But it's manageable. It is controllable. It's controlled over time. In fact, the interesting thing is that once it is detected early, there are some people that do intensive lifestyle changes, especially for those who don't have strong positive family history, people who are able to pick it early. Maybe there's a borderline there, and then they adjust their lifestyle, sleep better, eat better, exercise regularly. If they need to lose weight, weight reduction, if they are overweight or obese, these are important factors. In fact, we need to keep emphasizing this lifestyle modification.
Okay, let's quickly talk about the cost of medication, access to medications, and of course, there are some. Someone actually sent me this question. Would rather resort to the use of herbs instead of the, what is it called now? Instead of those medications that were recommended by doctors.
Yes. I would say no.
To herbs.
Yes, please. Now, of course, when we talk about herbs, there is the complementary alternative medicine. I'm a family doctor, and interestingly, today is World Family Doctor Day.
Wow.
And this week is World Lifestyle Medicine Week. Interesting. So a lot of things about our health and the focus on living a healthy lifestyle. Now, do you know that our choices, not just the food, not just the exercising, not doing a sedentary lifestyle, the other factors that I didn't mention earlier, alcohol intake. So some of these herbs are not just water-based, they are made with alcohol. Alcohol damages the blood vessels, worsens the control that the blood vessels have to have on the blood pressure control. Now, it affects the heart. Even smoking damages the blood vessels. So it affects in such a way that the heart now begins to work, try to do more work to compensate for this pressure. Now, talking about choice of herbs, I wanted to say earlier
and the
about
cost of medication.
The complementary alternative medicine aspect has to do with some natural remedies, that's what we call them, herbs that have been found to be useful or important in managing hypertension. So we are not neglecting, we are not saying all herbs. For example, we talk about zobo, commonly called around here. Hibiscus leaves, right? So, naturally, there's a study that has been done on that to say that, oh, it's
we have less
helpful
than a minute to
in
go,
control.
Doc.
Wow. So we need to do that without sugar and turmeric. There's some other things, but there are some leaves that people put together that are not helpful. In fact, they worsen,
medically you cannot guarantee.
Thank you.
Okay, we'll have to leave this conversation here this
you.
morning. Of course, it's been an awareness, and hopefully we'll be able to do this from time to time just to ensure that, of course, we all live in good health, and we are also open to some of these conditions so we can modify our lifestyles. Thank you so much, Dr. Tamilare Soyemi, Senior Registrar, Family Medicine Department, LASOTH, for being here on the program today.
Welcome, Thank you.
All right, we'll take a quick break. When we return, the conversation continues.